Hi everyone, my name's Amanda and I'm going to be doing my teaching learning assignment with my husband Steven today, and I'm just going to start off the video in the med room performing my 3 checks. I compared my fentanyl transdermal patch with my patient's MAR, and I did that twice before bringing this to the room. This is a unit dose. So I am going to perform my 3rd check at the bedside. I went ahead and I also assessed my patient for his blood pressure, pulse, and respirations, as well as doing a pain assessment with him, all as part of the necessary assessments for a fentanyl transdermal patch. Everything was within normal parameters. So I'm going to go ahead and not only administer this to him, but I am also going to teach him how to do it himself at home when he discharges today. I'm going to go ahead and go into the room. Hi, Stephen. My name is Amanda. I'm going to be your nurse today. Can I please have your name and birth date?
So Stephen Gambesha, 4/17/91.
All right, thank you. Any allergies I need to know about?
No.
All right, I'm going to go ahead and show you how to apply your fentanyl patch. At the end, I'm going to ask you to please teach it back to me so that I know that you'll be able to apply it when you are home. Sorry, I'm just going to adjust this a little bit. Okay, so this is your medication order. You are prescribed Duragesic, which is the trade name for a fentanyl transdermal patch. Your order is 12.5 micrograms per hour, and the route for application is a transdermal patch, and your time and frequency is 1 patch every 3 days. So as you can see, he already has his old patch on, and he's due for a change now, so I'm going to go ahead and do that with him. I'm going to be describing each step with you, and then at the end, like I said, you're going to teach it back to me. Alright, so the first thing I want to do is I'm going to, like I said in the beginning, I'm going to assess him, his blood pressure, pulse, and respirations, as well as a pain assessment, just to make sure that everything is within normal parameters, because fentanyl transdermal patch is a respiratory depressant, so it is very important to assess the vital signs first. And it's also an opioid analgesic, so I have to do a pain assessment with him to begin with. Opioid analgesic, specifically this fentanyl transdermal patch, is used to treat severe chronic pain. So his pain assessment was around a 7, so this is good. It's definitely time for him to receive this medication. Okay, so first what I'm going to do, and you should do when you are home, is you're going to inspect the package. Look it over, check the expiration date on it, make sure it isn't opened or damaged in any way. If it is, dispose of it. And when you're disposing of it, whether it's your old patch or if it is a patch that's defective, it's really important for you to fold it sticky side to sticky side and flush it down the toilet when you're home. This medication has a risk of overdose and toxicity to anyone that comes in contact with it that shouldn't have it, so it's really important that you dispose of it by throwing it in your toilet and flushing it that way. Never throw it in the garbage, okay? Alright, so the expiration date is 2025, so we're good to go. I'm going to go ahead and wash my hands, perform hand hygiene, put on my gloves, and then I'm going to just go ahead and take off his patch. I'm going to do that by grabbing the outer corner and pulling it as not to hurt him. And then I'm going to fold it sticky side to sticky side, and since we're in the hospital setting, I'm going to dispose of it in the needle sharp container, which is right over here. Okay, and now I'm going to inspect this area and make sure there's no redness, irritation, or skin breakdown, as well as clean it with some warm soap and water to get off any leftover adhesive or any leftover medication that could harm him. And I want you to do that when you're at home as well, okay? After you dispose of it, go ahead and clean off this area. And in order to prevent any other type of skin breakdown, the sides of the patch need to be rotated each time. So since the patch was on this side, it needs to be on this side now. When you're at home, it might make it easier for you to remember which side of your body you put it on. So if you put it on the right side, always go to the left afterwards to avoid any skin breakdown or skin irritation. Okay, and now I'm going to choose to place the new patch on this side of his chest, and this area of the body is conducive to a transdermal patch because it's not too oily, it doesn't get rubbed too much, so it can sit nice right here. Okay, so I have my gloves on, like I said. I cleaned my old site with warm water and soap. I'm rotating sides, and then I'm going to open up the patch. And on the back, there are 2 sticky sides. I'm going to take off one of these, making sure not to touch the sticky part because that's where the medication is. I'm going to press firmly on the patch, lift the back of it up, remove the other half, and press and hold firmly for 15 to 20 seconds. And that's what I want you to do at home. I want you to take it off just like that, one side of it first, then the next, and then press and hold firmly for 15 to 20 seconds. All right, I'm gonna go ahead and take off my gloves. I'm gonna perform hand hygiene again, and then I am going to wait a few minutes, wait for the drug to take effect, and then I'm going to reassess his pain level, make sure that he's tolerating the drug well, maybe redo vital signs as well to make sure that he's still well within normal limits to be continuing to receive the dosage of the fentanyl patch. Alright, so now I just wanted to talk to you a little bit about some adverse side effects of your medication. So these are some things that I'd like you to please call your doctor or call us back here at the hospital if you're experiencing any of these things. So your medication is a respiratory depressant. So some of these adverse side effects might include apnea, which is not breathing, and respiratory depression, which means a low breathing count, not breathing. Maybe you might be experiencing some low heart rate as well, trouble breathing. If you're experiencing anything like that, please call emergency services. Another adverse side effects of your medication is a physical and psychological dependence. So if you're experiencing any of those symptoms, please reach out to your doctor. And central sleep apnea. So I'd like for you to have a family and caregiver monitor you while you sleep to make sure that you're breathing during your sleeping time. And if you're not, please call your doctor. Some other side effects that you can expect are maybe weakness, dizziness, redness, nausea, and confusion. If you're experiencing any of those and it's causing discomfort for you, please reach out to your doctor and see if there's anything else that we can do to help you. And another thing I'd like to tell you as far as directions go, please take this prescription only as prescribed. It is an opioid analgesic, like I said, with a risk of abuse. So please take it as prescribed. Never let anybody else take this medication from you. Please store it in a safe place that's away from children and animals. And like I said, please dispose of it properly by throwing it in the toilet and flushing the toilet when you are done with it, folding it sticky side to sticky side, just to make sure that nobody that's not supposed to have it gets a hold of it. Another point that I wanted to mention to you is please make sure that you're switching spots, like I mentioned. Ask for assistance if you're experiencing any dizziness. Make sure that when you sit and stand and change positions after you apply your patch that you're being careful to avoid any dizziness upon standing. Avoid grapefruit juice while taking this medication. And just make sure that if you're experiencing any overdose symptoms, that you have naloxone available, which is an opioid reversal drug, and you have availability to call emergency services. Okay, and then I have some paperwork to give you as well as going over some of your goals for your patient education. I'd love for you to please teach back the steps of the administration of your fentanyl patch to me. We can go over any questions and discuss your goals. Does that sound good?
Yes.
All right, I'm going to hand you your papers and just please go over the steps of how to apply the medication with me.
Okay. Step 1, I will wash my hands,
Okay.
ready my hands, make sure my hands are clean. Then I will remove the patch,
What would you do before that?
check my blood pressure.
Yeah, make sure you
Okay.
check your
Yes,
vital
that's right.
signs.
I have to
and
check
also-
my vital signs, blood pressure and pulse, make sure those are all okay.
Yep.
Then I will go on to wash my hands, put gloves on, and then remove the medication patch. And I would take that off.
Doing good.
And then sticky side to sticky side, flush it, don't throw it away. I will also be switching sides, so if it was my right side on there, I will switch it to my left side.
Great.
And to apply that, I will apply it almost like a Band-Aid where I take one side off, press it down, then the next side fold it over, hold it for 15 to 20 seconds until that is over, let go, take my gloves off, wash my hands again, and then I would wait and see for the effects to hit.
Great. Also, just don't forget to make sure that you're inspecting the package, making sure that there's no damage to it.
Gotcha.
Exactly.
Yes.
So you did really good. This is all your paperwork. I just wanted to ask you, do you feel confident applying your transdermal patch when you're at home?
I do.
And do you understand thoroughly and fully all the steps of the medication administration for your fentanyl patch?
I do.
All right, great. So